This lecture introduces asthma, a preventative chronic respiratory condition affecting millions worldwide. We'll explore its causes, include genetic and environmental factors, and discuss the effective management strategies to control symptoms and improve the quality of life. Understanding the impact of asthma on daily activities and the healthcare system is crucial for developing better support and treatment approaches. We are going to go through an overview of what asthma is. Then we will discuss some of the triggers. We'll discuss the signs and symptoms of asthma, along with its diagnosis and the two types of asthma. And finally, an overview of asthma management and treatment options, along with future treatment possibilities. Asthma is a chronic inflammation disease of the airways leading to episodes of wheezing, breathlessness, chest tightness, and cough. It is classified based on severity and control, ranging from intermediate to severe persistent asthma. Asthma is characterized by inflammation of the airways, in which there is an overabundance of epithelial mast cells and active T helper lymphocytes. Asthma symptoms are driven by the inflammation of the airways, which triggers a process such as mucus production, remodeling of the airway walls, and bronchial hyperresponsiveness, better known as BHR, which is the tendency of smooth muscle cells to react to nonspecific stimuli such as cold. This is also why magnesium sulfate works so well on treating asthmatic patients in emergency settings. Asthma affects people of all ages worldwide, with higher prevalence in children and in urban areas. Understanding the epidemiology helps identify trends and inform public health strategies. The main feature of asthma is airway obstruction, which is caused by the reduction in the diameter of the airway. The narrowing of the airway is mediated by chronic inflammation of the airway walls, characterized by the inflammation and activation of immune cells and the cells within the airway. There is a complex interplay between these immune cell types and the neighboring structure cells, which as epithelial cells, which leads to the development of asthma features such as BHR, which in most cases is reversible by the use of bronchodilators like albuterol and Duonos. However, in more severe forms of asthma, airway obstructions do not always normalize following these therapies. In such patients, the development of long-lasting mucus plugs in the smaller airways might explain the fixed airway obstructions that patients might develop. Risk factors include genetics, environmental exposure, and lifestyle. Vulnerable groups include children and elderly and individuals with allergens or other respiratory conditions. Asthma can be induced by different stimuli, including allergens, pollutions, cold air, and microbes. Such agents induce an enhanced inflammation of the lungs that worsens the symptoms of the existing disease. Among these agents, respiratory virus, especially RSV and rhinovirus, are the major driver of asthma exacerbation in children and adults. Several environmental risk factors have been identified to increase the risk of the asthma, such as exposure to air pollution and tobacco smoke, as well as occupational risk factors. More are listed within this slide, as you can see. Pet fur, mold, mildew, food allergens, dust, cockroaches, colds. These are things that we're exposed to on a daily basis. Genetic factors also influence susceptibility with environmental exposures such as pollution, smoke, and infections can trigger or worsen asthma symptoms. Asthma represents a dysfunctional interaction with our genes and the environment in which they are exposed. The increased prevalence of asthma in all age groups indicate that our living environment and immunity are in a balance in which others are reacting with airway inflammation to the environment exposures and often non-harmful proteins such as allergens causes the current asthma and allergy epidemic that we are seeing today. Common asthma triggers include pollen, pet dander, dust mites, mold, tobacco, smoke, and strong odors. Avoidance and control of these allergens are critical in asthma management. Exercise can reduce asthma symptoms also in some individuals. Occupational triggers such as chemical fumes or dust can also provoke asthmatic attacks, requiring specific preventive measures. This includes any kind of exposures at work, play, public places. Typically think the symptoms of asthma are wheezing along with shortness of breath. However, as you see in the list below, there are many more symptoms and diagnoses. They can have running noses, a chronic cough, be sniffness, excessive mucus, itching eyes, sneezing, wheezing. So there are more than just a common of just hearing wheezes and shortness of breath that people may experience. Like I said in this slide before, symptoms include the wheezing, shortness of breath, chest tightness, and coughing that we're all commonly known for asthma. Especially this happens at night and early in the morning. These symptoms may vary in intensity and frequency compared with each individual. Diagnosis of asthma involves clinical evaluations, the use of a spirometer to measure lung functions, and sometimes allergy test or a chest x-ray to rule out other conditions. Clinicians now realize that asthma is a very heterogeneous disease in which different angiotypes. This is best reflected by the result of the different clinical trials using different biologics in patients with asthma. Blood work and genetic studies are being used to diagnose asthma, shuffling away from traditional methods that have been used in the past. Conditions like chronic obstructive pulmonary disease, better known as COPD, bronchitis, or heart failure may mimic asthmatic symptoms. Careful differential diagnosis ensure the appropriate treatment. This can make treating asthma in the traditional ways difficult and worsen the patient's condition overall. Asthma is usually easy to manage, but approximately 5% of patients are not controlled, even on a high dose of inhaled corticosteroids. It is essential to assess these patients carefully and identify whether any correctable factors may contribute to their poor control. It is critical to make a diagnosis of asthma and to exclude other airway diseases, particularly COPD and vocal cord dysfunction, pseudoasthma. Poor adhesion to therapy, particularly inhaled corticosteroids, is a common reason for the inadequate response. May be unidentified expression factors, including unrecognized allergens, occupational sensitivity, dietary additives, drugs, gastroesophageal reflux, upper airway disease, or other sympathetic systems diseases that need to be identified and avoided or treated. Treatments involve optimizing corticosteroid therapy, addressing additional controls such as long-acting inhalers or subcutaneous beta-2 agonists or subcutaneous. Theraphin and hydrokinase. In some patients, these are used if immunosuppressant treatment and may reduce the use of steroid requirements, although these treatments are rarely effective and have side effects. In the future, the non-steroid anti-inflammatory treatments now in development may be helpful in these patients and in further care of others. Asthma treatments include quick relief inhalants for acute symptoms and long-term controlled medications to reduce inflammation. Proper inhaler techniques is crucial for the effectiveness of these treatments. Also, asthma action plans guide patients on managing worsening symptoms and when to seek emergency care. Prompt response can prevent severe attacks and complications, and delaying can increase hospitalizations of patients that delay treatment. In conclusion, managing asthma, even though it is a chronic condition, can be effectively controlled with proper understanding and medical treatment.